Right, I think it's probably time for me to make a start, given time is precious and all of that. Welcome everyone to this latest meeting of our Homelessness Research Network. For those of you who don't know me, I'm Stephen Aldridge, the Director for Analysis and Data at the Department for Levelling Up Housing and Communities in the UK. I'm also a trustee and board member of the Centre for Homelessness Impact, which organises these meetings. Given our numbers, we don't have time to introduce everyone, but please stand ready to say who you are if and when you contribute to the discussion. Obviously, there's opportunities to put comments in the chat box. Just by way of background, the purpose of our network is quite straightforward: to bring together homelessness researchers and users of homelessness evidence, to share knowledge, evidence, and the latest research, to facilitate mutual problem solving and learning, and to make national and international connections for homelessness researchers. Once again, we've a fascinating agenda with 3 excellent presentations to come, for which I'm very grateful to our speakers. Our presenters include Margot Kushel, Director of the Benioff Homelessness and Housing Initiative in California; Beth Watts-Cobbe, Senior Research Fellow and Deputy Director at the Institute for Social Policy, Housing and Equalities Research at Heriot-Watt University; and Niamh Flannigan, Implementation Lead at the Centre for Homelessness Impact. Please do think about questions or comments you'd like to ask or make as we go along, and be ready to use the raised hand function if you'd like to ask a question when we get to more formal sessions for asking questions. You can also use the chat function to make comments, share other relevant work, and ask questions as we go along too. And I'll do my best to pick up everyone's comments and questions and put them to our presenters. Please don't be shy about feeding in comments or asking questions or sharing other relevant work, given the excellence of our speakers and the purpose of this meeting and network. So that's all I wanted to say by way of introduction. Great to see a good number of people on the call. Only other thing I wanted to say by way of introduction was to remind our presenters once again to stick to time. Let me turn though to our first agenda item. So Margot Kushel on the California statewide study of people experiencing homelessness. Margot is Professor of Medicine at the University of California, San Francisco, and Director of the Benioff Homelessness and Housing Initiative. Her research interests focus on reducing the burden of homelessness on health through examining efforts to prevent and end homelessness. So themes that great interest to people on this call and to those of us who are grappling with these issues in the UK. So Margot, absolutely fantastic to have you with us. Over to you, and you've already got your slides ready. Brilliant.
Thank you so much. It's really wonderful to be with everyone. I am talking about our work in California, largest state in our nation, and I'll talk a little bit about that. I'm calling in from our nation's capital in Washington, DC. So I just wanted to start with some framing. In the United States, I think this is a common confusion. When the public asks, why are people homeless, which they ask all the time, they often are really asking 2 different questions. This is from their marvelous book, In the Midst of Plenty, that Mary Beth Shin and Jill Kaduri wrote. They're often asking 2 different questions. Why are there so many people in a region that are homeless? Why are so many people in Los Angeles experiencing homelessness? Why are so many people in California experiencing homelessness? But they also intuitively are asking, why is this particular person experiencing homelessness? The answer to the first really leads to structural descriptions because of the high cost of housing, the lack, income inequality, and the like. The second often leads you to answers that tend towards individual vulnerabilities. But certainly in the US, People often ask the first question and answer it with the second, and it has really, in some ways, shut down our political dialogue. Just to give you a sense of our structural inequities in our country, this is an indicator put out by our National Low-Income Housing Coalition that looks at the availability and affordability of housing for the lowest income households. This looks at the availability of housing for every 100 extremely low-income households. Extremely low-income households are households in our regions that make less than 30% of the area median income of that region. So that obviously varies a lot. And then available and affordable means there's a unit of housing that exists. It's habitable. It's not occupied by a higher income household who could afford more. And importantly, it's affordable at less than 30% of that household's income. The idea being that if a very poor family tries to spend more than 30% of their income on housing, they don't have enough money for healthcare, for food, or anything saved. Nationally, in our country, we have 34 units of housing that are affordable and available for every 100 extremely low-income household. We're short over 7 million units. In my state of California, we have 24 units for every 100 extremely low-income household. We are basically short 1 million units of housing. And if you look on the map, all the states in red are the states with fewer than 30 units. And with the exception of New York, which is sort of its own special thing, they are to a state, the states with the highest prevalence or proportion of the population that experiences homelessness. So there's a pretty one-to-one association. In our country, homelessness is really an issue of racial injustice. In our country, the primary means where there has been intergenerational wealth transfer has been through home ownership. And until very recently in our history, there was legal discrimination in home ownership. So basically, until the late 1960s, it was legal to say that you could only sell your house to another white person. This created neighborhoods that were people of color and neighborhoods that were white people. Our mortgage system, which is backed sort of federal backed mortgages, were allowed to not offer mortgages to people who lived in those neighborhoods that people of color could live in. This led to not only enormous racial segregation, but investment and disinvestment, and the fact that people of color have very little intergenerational wealth. This has been illegal in our country since the late 1960s, but we still see rampant discrimination in home ownership and home rentership and other things. You add to that all of the discrimination in criminal justice, employment, and educational system in our country, and it's perhaps not a surprise that Black Americans are at a 3- to 4-fold increased risk of homelessness. So I'm going to present data on from this study Toward a New Understanding, the California statewide study of people experiencing homelessness. We released it last June. Tomorrow morning, we're releasing another report based on this on older homeless adults. This is the largest representative study of homelessness in the United States since the 1990s, and our California Department of Health and Human Services asked us to do it to answer some policy questions. We basically divided our vast state into 8 regions that are often used for policy planning. We just fed a ton of information into a computer model and selected one county from each of these 8 regions to be able to balance out to do the state. We use venue-based and respondent-driven sampling and weighted everything for sampling weights. We did it, our target population was adults 18 and over. We did 3,200 questionnaires, 365 paired in-depth interviews. We did everything in the predominant languages, English and Spanish, and then used interpreters for others. And even though it's hard to be less community engaged than to have the governor's office in the biggest state in the nation ask you to do this, we had a lot of community engaged practices, including everything was guided by a board of those with lived experience from across our state. So who experiences adult homelessness in California? First of all, there's a lot of mythology in our country that everyone thinks that people goes to their states or their cities to be homeless. We found that 90% of people had been last stably housed in California. 75% were living in the same county, and a significantly higher percentage of people were born in the state than Californians overall. Here you see the racial inequities. 26% reported a Black racial identity versus 7% in their state overall. 12% reported native identity versus 3% overall, so indigenous peoples, and 35% reported a Latino, Latinx identity. That's a little bit of an overrepresentation, but it is rapidly skyrocketing. Like most studies of homelessness, or most populations of people experiencing homelessness, we did find it was dominated by cisgender men, 69%, 30% cisgender women, and 1% identified as trans or non-binary, although when you went to the younger adults, it was much higher percentage with a trans or non-binary identity. Oops. Let's see why it's not advancing. Sorry about that. There we go. This population is aging, and this is what the report we're releasing tomorrow morning is on. The median age of the sample was 47. Everyone had to be 18 to be in the study. The oldest person we spoke to was 89. 48% of the single adults. So in the US parlance, single adult means you're not a parent in a homeless family, or you're not a very young adult under the age of 25. It makes up 90% of the sample are single adults. 48% of them were 50 and older. And of those who were 50 and older, 41% had never been homeless, not even for a night, before the age of 50. Once people became homeless, they stayed homeless a long time. Obviously, cross-sectional study, we're going to overrepresent people with long periods of homelessness, but still, the median duration of homelessness episodes were 22 months, and 36% met our federal criteria for chronic homelessness, which in the US is both a temporal criteria, basically homeless more than a year, or 4 more episodes in the prior 3 years that last more than a year. Actually, over 3/4 met that. And then you have to have a certain disabling diagnosis. When you put those together, over 1/3 did. So how did people come to be homeless? So 19% of everyone in the sample had entered directly, like the night before homelessness, into homelessness from an institution. This was dominated by long-term jail stays or prison stays. The next biggest group was people leaving drug treatment centers. And it's likely an underrepresentation because a higher proportion had, let's say, left prison in the prior 6 months, but then did get stable housing. 49% came from housing, but it was housing for which they had no legal rights. So it was people doubled up with family or friends, sort of staying at the goodwill of family or friends. And 32% entered from a housing situation for which they had legal rights. People had very little warning before they became homeless. On median, it was 5 days. Those non-leaseholders, it was 1 day. They were staying with family or friends. Things fell apart. They fell apart quickly, and they had to leave. Interestingly, though, among the leaseholders, it was 10 days. In California, there's relatively strong renters' rights. You can evict someone in 3 days if they're very behind in their rent, but that's pretty rare. Usually you should have 30, 60, or 90 days notice. What we found is when people got threatened with eviction, they just left because they had nowhere to seek help. And they very much, with good reason, feared having an eviction on their record, which really impedes efforts. Incomes were extremely low. To give you some context for these numbers, in our state, the median cost of a 1-bedroom apartment is $1,400 a month, just to give you like a sense of what these dollar amounts mean. And yet the median monthly household income for the whole household was $960. So significantly less than the cost of a 1-bedroom apartment. Non-leaseholders, it was $950. 43% of them had paid no rent. So they were just staying with the goodwill of family or friends. Among those who paid rent, they paid on the median $450 a month. Leaseholders had a little more money, $1,400 a month, but they were spending $700 a month per rent. So they were spending half of their income for rent, trying to run their whole household on $700 a month, which is completely non-sustainable. But also, once they lost that, there was no place that they could re-enter the housing market for such low rent. We put people through a series of hypotheticals, taking them back to the time in which right before they lost their housing, to ask them what would have kept them housed. 70% said, had they been given $300 to $500 a month, they would have been able to work it out and afford to stay either where they were or someplace else. A significantly higher percent, 82%, thought had they been given $5,000 to $10,000 once, they could have paid back rent, paid for first and last month's rent to move someplace new or something else. And then 90% thought that what we call a housing choice voucher, we described it rather than using its name. It is the one way really to get rental assistance in our country, where you basically get a voucher from the federal government. You can use it on the free market. You pay 30% of your income on rent, and the federal government pays the rest. 90% thought that that would do the trick. I will mention in our country, only 1 in 4 households who qualify get this voucher, just because there's just not enough money attributed to it. So what happened to people while they were homeless? Most of the time, we're running around trying to figure out where we're going to sleep at night. We're not worried about going to the doctors or going to see somebody to get help with our mental state. It was an extremely harrowing experience. Most people who experience homelessness in California do so without any shelter. 78% spent the majority of their nights in the past 6 months unsheltered, 21% living in a vehicle, the rest in a non-vehicle setting. This was a photo that we took during our trip. This is what a lot of California looks like now. Only 22% had spent the majority of their nights in any form of shelter. 41%, however, said that there was a time that they had tried to get shelter, but were unable to access this. This is important because right now there's a lot of talk in California about arresting people for rejecting shelter, but there really is just no place to go. 45% reported that their health was poor or fair. 60% reported having at least one major chronic health condition, even though access to care was poor, so they might not know that they had diabetes, cancer, and the like. And 34% reported a limitation with an activity of daily living, like being able to toilet without assistance. In the past 6 months, 38% had had a treat and release visit to an emergency department, where they had gone to the emergency department and been released. This is astronomically higher than the rates in the general population. And 21% had been admitted overnight to the hospital for a physical health reason. Lots of mental health concerns in their lifetime. A quarter had received a diagnosis of post-traumatic stress disorder. 31% had actually attempted to take their lives. And 27% had had a psychiatric hospitalization. Almost half of these, 44%, had happened after they first became homeless. We asked about current mental health symptoms, and we asked about serious or severe symptoms. 2/3 had them, but it was mostly driven by serious symptoms of either anxiety or depression. 37% said that they had trouble remembering, concentrating, or understanding, and 12% were having active hallucinations. 5% had experienced a psychiatric hospitalization in the prior 6 months. Drug use was common, and it was almost entirely driven by methamphetamine use. 35% reported using illicit drugs 3 or more times a week during the current episodes, 31% meth, 11% non-prescribed opioids, 3% cocaine. Most people who used non-prescribed opioids were also using meth. 9% reported current heavy episodic alcohol use, and 40% reported either regular illicit drug use 3 times a week or more, or heavy alcohol use. Of those who seem to potentially have a substance use problem, either by regularly using substances or weekly heavy episodic alcohol use, only 10% were receiving any treatment, mostly through peer-to-peer networks. But 21% told us that they had wanted treatment currently, but had been unable to find any, and 26% said this has happened during their episode. We tried to figure out who might need robust supportive services and housing, and about half, 48%, either current regular illicit drug use, heavy alcohol use weekly, current hallucinations, or recent psych hospitalization. So what was keeping people from being housed? There's a lot of mythology in the United States that people experiencing homelessness don't want to be housed. That may be true for a few people, but across our state of California, we did not run into any of them. 89% said that the major barrier to their returning to housing was simply the cost of housing. We asked people to rate a whole bunch of barriers, and then they could tell us about more. And it was either a little or a lot. You can see that 89% thought it was the cost of housing, and it was mostly a huge barrier. Here were some other ones that I think are worth mentioning. 36% spoke about having a record with the criminal legal system as being a barrier, because there's rampant discrimination, often allowed to discriminate against people with criminal legal contact. 49% said either prior credit history or prior evictions. We're getting them screened out for any housing options. 43% told us about experiencing discrimination on the rental market, often on the basis of their homelessness, but often because of race or ethnicity. And 53% said they don't have the documents they need to apply for housing. What they mean is that they literally don't have a piece of paper saying who they were, ID card, a driver's license, a proof of anything. As you can see, most people were living outside. In California, the government comes and sweeps people, meaning that they come into an encampment and throw everything out. And over a third of people had said that they had lost everything that they had at least once in the prior 6 months. So all their documents get thrown out and then they can't get any way back in. We sort of gave the same hypotheticals, whether this would help them meaningfully return to housing and stay housed. 86% thought with an additional $300 to $500 a month, they could get back into housing. 95% thought if they got $5,000 to $10,000. 96% thought if someone would give them one of those precious housing choice vouchers. And 94% spoke about the need to have somebody to help them navigate the system. People told us they were just sitting out there in encampment. They had no phone, they had no documents, they had no access to the internet, they hadn't taken a shower, they had no way of knowing what housing was available or advocating for themselves. So what did we recommend? We have a whole bunch of recommendations to our local, state, and federal government. But the first point we made is that every single route to ending this crisis has to come through increasing access to affordable housing options. We've got to close that gap, that 24 units per 100, in order to have any chance. We also desperately need to expand housing assistance. The city of San Francisco recently, for the first time in 10 years, opened up the wait list to get one of those vouchers. They opened it up for 2 weeks. 65,000 households applied for 6,000 spots on a waiting list that would get you on a waiting list where in the next 10 years, you might be able to get the voucher. We need to build housing, create housing at every price point, but particularly for those with extremely low income. We need to expand targeted prevention, and we're recommending starting with people leaving institutional care because those are the easiest people to know that they're going to become homeless because, of course, for prevention to work, you need to be both effective but also efficient. You've got to get the people at highest risk. This population has very significant behavioral health needs because it is a risk factor for becoming homeless, but also because of the trauma of homelessness. We need to provide adequate supports to support people in their housing. We need to increase household incomes by increasing both what benefits pay, increasing enrollment in benefits, but also giving more access to labor markets. We can't leave people out there to die as we're currently doing, so we need to increase outreach and service delivery during homelessness. And finally, because of the deep, deep racial inequities in our country, we need to embed racial equity in everything that we do. Homelessness related to the lack of deeply affordable housing. It says an aging population and poor health, high prevalence of behavioral health conditions, very poor access to care. The experience is harrowing and filled with violence and despair, and ending homelessness will require sustained efforts to address root causes. Thank you so much. This is my contact info. And I think, are we taking questions later? Oops, I think you're on mute.
Sorry, I was on mute myself. So Margot, look, an absolutely fantastic presentation. And I know there's lots of differences between our two countries, but your emphasis on the need for more affordable housing, prevention and addressing mental health problems rang lots of familiar bells for me. I'm very happy to take a couple of questions. Who would like to go first? So Glenn Bramley, your hand is up. Could you introduce yourself, Glenn, and then ask your question or make your comment, please?
Yes, Glenn Bramley from Heriot-Watt University, a colleague of Beth, who you're hearing from shortly. I was interested, I think I heard you say that you used respondent-driven sampling, respondent-directed sampling, which I was really interested to hear. It's a technique that I think is still not very widely known. We used it in one small study in the UK. Did you find, have you compared your profiles with earlier surveys that purport to cover the same population? Do you think there are any differences? Are you confident that it's pretty representative? You sounded that way, but and have you had any pushback because it's a relatively unknown technique?
Yeah, so we primarily used venue-based sampling. So we did about 3,000 of 3,200 came from venue-based sampling, which we actually have a paper coming out in the American Journal of Epi soon to describe how we did our venue-based sampling. But we knew that there were certain populations in the US that don't show up in venue-based sampling. So we did really complex sampling design with all the encampments and food lines and homeless shelters. But we were particularly concerned about people with trans and non-binary identities who often really try to stay very hidden. In our country, we're very worried about day laborers or immigrants who work in the fields, let's say, who sleep in fields in rural areas, don't speak even English or Spanish. They often speak indigenous languages from Central America. We were worried about young people who tend not to use those services, and then people in domestic violence shelters. So for those populations, we used RDS. We've gotten a little bit of pushback, but we actually developed methods that I think the real innovation was developing a method to try to combine that with our venue-based sampling data. And I think partly people don't understand it well enough. I think that we did look at the comparison and we did achieve our aims. Those populations of interest in the RDS sample just did not show up in our venue-based sampling. The one group we still feel like we really underrepresented were young people who, even with respondent difference sampling, it was super hard to find them. And so the 18 to 24-year-olds. But happy to share more about our methods. And we have this paper coming out soon in AJE, and then we're writing another one with a deep dive into the RDS methods.
Fantastic. Thank you, Glenn. Good question. Does anyone else have a question they'd like to ask or a comment they'd like to make? I would encourage people, if you've got reflections, you can write them into the chat box too, which Margot can pick up as we go along. If not, just one thing from me.
Sarah, I think Sarah.
Oh, sorry, have I missed that? Sorry, where was? Oh, yes, sorry, yes, Sarah Christou, yes. Could you introduce yourself, Sarah, and ask your question, please?
Sure, thank you. I'm Sarah Christou. I'm a doctoral researcher at Loughborough University. I'm been conducting research in London on women transitioning out of homelessness. But one of the things that came up in the conversations is that, I'm sure you and others here will know obviously about the hidden nature of women's homelessness, how they tend to avoid shelters if they're mixed gendered, how there's not enough women-only accommodation, and that obviously women aren't sort of more visible in terms of their rough sleeping or have kind of other relative forms of homelessness in terms of, night buses, 24-hour McDonald's, hospital toilets, etc. But one of the things that came up in my interviews with women is that when they did encounter outreach services, they needed to almost prove their rough sleeping, that they had to have been outside for 3 nights in a row before they would be allowed to even access. So there's an issue, certainly in England and Wales, of this idea of being verified as this before being offered help. I don't know whether, obviously we're talking about trans and non-binary identities. Obviously, there's a focus on race and discrimination too. I wondered if there was a focus on gender differences in your survey, and also whether there is this issue of being verified as homeless before being able to access services.
Yeah, those are great questions. I think in the US context, well, particularly in most of the western part of the US, so I should say like the California, 12% of the US population, 28 to 30% of those experiencing homelessness. So we are ourselves a huge bulk of those. Most people are unsheltered. We used a bunch of methods to try to find women. There are some women-only programs like women drop-in shelters and things and women's shelters, and those were included in our sampling methods, but we also had a lot of community contacts sort of telling us where women were hidden. We did a lot of work, particularly on domestic violence, and interestingly, most people who had left because of DV were not in our DV shelter system. Most had fled and were just outside because there was no room in the shelters, or they didn't even know about it, and lots of survival strategies, lots and lots of sexual and physical abuse, which was much higher for the women. And once people became homeless, it was mostly through strangers as opposed to someone known to them. We don't quite have that same documentation issues as much as that we have almost no services, you know. So like the good news is it's a little, you can present and they don't tend to question whether you've been rough sleeping or not. The bigger issue is that there's just such a huge shortage of services and no sense of like an obligation to provide them.
Thank you. I'll take one more question quickly, then I'll need to move on to our next speaker. So Rhiannon Yandi, your hand is up. Could you introduce yourself, Rhiannon, and please ask your question?
Yeah, hi. Can you hear me?
Yes, we can.
Oh, beautiful. My name is Rhiannon. I work for Change Communication. And we provide speech and language therapy for people experiencing homelessness. And I'm actually from California. I went to UC Berkeley, and
I live in Berkeley.
Oh, wow. Yeah, I worked at like a small homeless charity there for a bit. And I noticed like your presentation was amazing, and so it's really interesting for me to like work on both sides of it. But here I've noticed that there's a very large emphasis on preventing street homelessness. Like there's like rough sleeping is just not as much of an issue at all here, and that's so different from Berkeley. And so I was just a little surprised, like at the end of your presentation, that there wasn't like a recommendation for expanding like shelter options. And I'm wondering if that's like something you think will be a focus in like coming years, or you think it's just not a priority at the minute.
So it's a really, really, really interesting policy discussion and a very loaded one in the US. So for instance, New York, there's a right to shelter. And anyone can present and the state is obligated to give shelter because of a legal decision in the late 1970s. It's actually becoming questioned because of the migrant crisis, and a lot of migrants have come to New York and they're actually questioning their right to shelter. Depending on the quality of the shelter, it's usually better than sleeping outdoors, although not always. But the bigger issue is that New York is the one state that's the exception of that they're the one state that actually violate that rule that every state with the highest amount of homelessness has the lowest amount of housing, because almost all of their money is tied up in providing shelter. There's a huge emphasis in California now. People are really sick and tired of street homelessness. The non-homeless population is really outraged about it, and there's a lot of criminalization of it. We have a huge case in our Supreme Court of whether, in fact, you can be arrested basically for falling asleep outside, and I'm sure that the court is gonna overturn the ruling saying you can't arrest it, and so pretty soon it's going to be in the next month or so, you're going to be allowed across the country to arrest people for sleeping outside. Most politicians are running to try to get people out of public view. The question is, what they're talking about really are things that are more like, what would you call them? Like almost like concentration camps. They're talking about outside of cities, just building huge tent encampments and arresting people and giving them the choice to go there or to go to jail. So it's a very, very loaded topic. We obviously feel like there should be more high quality shelter, particularly pushing non-congregate shelter, but the use of things like hotel rooms and things. And like the city of Berkeley actually is one of the only places in California that reduced their homelessness over the last 2 years by using a strategy of they bought some hotels, they go into encampments, do a bunch of trust building, bring the entire encampment into the hotel, fast track them into housing from there, and then they go to the next encampment, and it's been very effective. But I think the reason we're not pushing on it is this fear that there's going to be this complete focus on just these sort of tent encampments outside of town and used as a punitive method. So it's just very charged right now.
Thank you so much, Rhiannon. I need to move on to our next speaker. Huge thanks, Margot. Terrific presentation.
You so much.
If people have got further comments or questions for Margot, please put them in the chat box, and Matt will circulate all the slide presentations after this meeting. Let me move next to Beth Watts-Cobbe, who's going to talk to us about the homelessness monitors produced by and for Crisis. Beth is a Senior Research Fellow and Deputy Director at the Institute for Social Policy, Housing and Equalities at Heriot-Watt University, with research interests in homelessness, housing, poverty, and social and welfare policies. She currently leads the 2021 to 2026 crisis-funded homelessness monitors, which track the impacts of economic and policy change on homelessness across Great Britain. So, Beth, fantastic to have you with us. This is a brilliant compliment to Margot's presentation. Over to you, and please stick to time, Beth.
Thanks very much, Stephen. It's lovely to be here. I have to say I'm still emotionally reeling from some of the things Margot said. I knew things were bad in the States, but some of those final things are just really shocking. Anyway, now for something in some ways similar and in some ways very different. I want to acknowledge before I get on with the presentation that the monitors are very much a team effort, and just a very brief shout out on the screen here to the wider team, one of whom's on the call. Hi, Glenn. So this is an independent analysis of the impacts of homelessness, economic and policy developments on homelessness. It's been running for a long time now, funded by Crisis. We focus, when we talk about homelessness and the Homelessness Monitors project, we're talking about three partially overlapping groups of people. People sleeping rough, so the unsheltered homeless population in the US terminology, statutory homeless households, i.e. those with legal entitlements to assistance because they're homeless, and I'll go on to say a little bit more about that for any non-UK participants on the call, and core homeless households. So that's those people affected by the most acute forms of homelessness, including rough sleeping, residing in unconventional forms of accommodation, not meant for human habitation, unsuitable temporary accommodation, bed and breakfast accommodation, for example, hostels, and those sofa surfing. And that concept of core homelessness was developed by us, by Glenn in particular, in partnership with Crisis. And I'll say a bit more about the findings in relation to that later on. So it's a very different beast in terms of a study from Margot's project. It involves a range of methods, review of relevant research and literature, interviews with key stakeholders across statutory, voluntary and housing sectors, quantitative analysis, both regarding socioeconomic trends, and you'll see a bit by what I mean by that in a moment, and quantitative analysis of data pertaining to the three homelessness groups I just mentioned. We also do a bespoke rolling survey of local authorities across the three GB nations, so England, Wales and Scotland. And it involves a statistical modelling exercise to estimate levels of core homelessness and project trends based on different policy scenarios into the future, and Glenn, who you just heard from, leads on that. We produced a report focused on England every year, and then we alternate a report every year on either Wales or Scotland. And you'll see a few more graphs on England and Scotland just because they're the most recent monitors we did rather than Wales, but I'll bring Wales into the sort of verbal analysis. So just because I know we have at least one US participant on the call, I'm going to give a very, very quick sort of long-term background to this. And that is that in the UK, we have three versions of a legal rights-based response to homelessness, meaning that many homeless households have a legal entitlement, not just to support or shelter, but actually to settled rehousing. This system started in the late 70s, as many on the call will know, and originally that rehousing entitlement was restricted to those who were eligible, those who were in so-called priority need, and those who were homeless unintentionally. But the most important thing to say about that is it mainly restricted the entitlement to families that included children. So since then, and since in particular devolution of housing-related powers to Wales and Scotland in 1999, we've seen three sort of frontiers on which legal reform to that original statutory framework has happened. So one, there have been a variety of moves to make the legal framework more inclusive. Most notably in Scotland, that priority need criterion has been abolished, meaning that in Scotland, virtually all homeless households have a legal entitlement to settled rehousing, including single men who are classically excluded. There's also been an increasing focus on prevention and bringing prevention into the legal framework. And what that's meant is that in Wales and latterly England, prevention duties on local authorities have been introduced. And crucially, those prevention duties, those duties on local authorities to prevent homelessness for those at risk, are priority need blind. So that that group of single homeless men do benefit from those prevention and relief duties to at least some extent. And the third frontier is really about who's responsible, and that's the most recent and the most nascent one. And that refers to the introduction of duties to refer, to cooperate, and to prevent homelessness on wider relevant or public bodies. So that could be housing associations or health providers, for example. So I want to just very briefly speak to the wider socioeconomic context, because of course, the operation of that statutory legal framework on homelessness is heavily influenced by the wider socioeconomic context. And in the monitor reports, we, by which I mean Gillian Young, my esteemed colleague, spend quite a lot of time in each monitor considering that changing context in each country. The headline here, of course, is of a deteriorating structural context. First of all, that reflects the UK struggling to recover from successive economic shocks. It also reflects, over the longer term, but also more recently, a substantial weakening of the welfare support system, initiated by welfare reforms by the 2010 to 2015 government, but continued since then, involving cuts and caps and increasingly conditional approaches to welfare support. And that's obviously been exacerbated more recently by increases in the cost of living. And for those reasons, we've seen increasing levels of destitution. That's really important for at least two reasons. One, welfare policy is not a devolved power. So this has affected the 3 GB nations. This has affected all of the 3 GB nations, and also because poverty is the main driver of homelessness. The housing context is also obviously fundamental, and it's a challenging and deteriorating context here too, across each of the 3 GB nations, in terms of a lack of access to affordable social housing, a decline in the availability of new social lets, an increasing reliance on the private rented sector, which is insecure and often expensive. But it's important to note here that the housing context does vary considerably by GB nation. So in particular, Scotland benefits from a higher proportion of its stock, around 24% is social housing, which is a real asset. Also variations in the tightness and the expense of housing markets, and also variation, quite dramatic variation, in the proportion of social homes allocated to homeless households. And that's something I'll come back to later and is quite important. The final difficult part of that deteriorating wider context is immigration policy. So note your interesting comments on that, Margot. The UK government's hostile environment immigration policies and also post-Brexit arrangements just mean that some households are excluded from any of those statutory supports and therefore really vulnerable to homelessness and rough sleeping. So I wanted to say something very briefly about scale before moving on. The GB-wide measure that we can most easily use is around core homelessness, and the nightly estimate that Glenn provides, and the one I've used here is the average nightly estimate in 2022, and that's around 300,000 households experiencing some form of core homelessness on an average night. I've also listed some sort of key figures on statutory homelessness demand, just to give a flavour, perhaps especially for people less familiar with the UK system, but they're not directly equivalent or comparable. And then importantly, I've included Glenn's estimate on the levels of rough sleeping on a typical night in England in 2022, partly because I just knew Margot would be speaking of scales of rough sleeping that were a completely different order of magnitude. Just for my own purposes, I looked up current unsheltered, the scale of unsheltered homelessness in LA, and I think it's 50,000 people, and in San Diego, which I have cause to go to once a year, which I think is 3,000, and this estimate here is for the whole of England, so a bit of a sobering comparison, really. Again, something briefly on profile. With regards to rough sleeping, some similarities with your findings here, Margot. We're primarily talking about males, single households, almost exclusively over 18. And 20 to 25% of those sleeping rough, sorry, this is not shown on the slide, are non-UK nationals, but much more than that in London and other cities. But thinking about statutory homelessness, this is what's shown on the graph here, statutory homelessness being those entitled to those forms of legal support. The main two groups are single adults and single parent families, and you can see that represented here. Young people are also overrepresented. It's worth mentioning that. And I just thought I'd mention the 3 sort of main drivers or triggers of homelessness across the UK are being, asked to leave the family home, relationship breakdown of some kind, or the ending of a tenancy, usually in the private rented sector. So just to give some context there. But in the rest of the presentation, having set that context, I want to highlight key trends and comparisons across the 3 GB nations. And I guess the overarching aim, my core kind of argument, is to illustrate with a few key examples the main story of the Monitors series, really, which is that policy choices matter for homelessness and can make a big difference to levels of and experiences of homelessness in both positive and negative directions. So the first way I want to sort of illustrate that is by comparing rates of core homelessness across the GB nations, and in particular focus on the distinction between the red line and the blue line, the situation in England and Scotland. The rate in England is just over 1%, and in Scotland is around 0.74%, according to Glenn's calculations. And there are really 2 key explanations here that I've already alluded to. One is the different housing market and housing system context in the 2 countries, and the other is the wider and deeper statutory safety net, the wider set of legal entitlements to homeless households, and in particular the elimination of that priority need criterion. The second way I want to illustrate that kind of core argument about the importance of policy choices is by looking at a few graphs on trends in rough sleeping. So the first one here, this pertains to England, and this is government collated estimates by local authorities, so not the data from Glenn I shared recently. And I want to just tell you the story in 4 core phases. That first major upward trend is really explained by some of the factors I mentioned earlier. The weakening of the welfare safety net, austerity and a cut to local authority budgets after the global financial crisis, and a philosophy of localism during which the central government essentially said that they'd leave dealing with homelessness to local authorities. And that radical upward trend is really what we saw as a result of that. In around 2018, the May government accepted that that wasn't working and initiated created a rough sleepers strategy and the rough sleepers initiative, investing and providing direction on responding to rough sleeping, and that saw numbers start to come down. That's phase 2. And then, of course, in phase 3, we see the impact of the COVID pandemic and the impact of a very, very inclusive accommodation-based response to homelessness. And that's what drove those levels of rough sleeping down so very dramatically. And then in the final phase, that recent increase, that is really the story of the winding down of those COVID protections in a very difficult socioeconomic context that we've seen over the last few years. We see a very different pattern in Scotland, however. This is rough sleeping data measured in a different way in Scotland. And over that same broad time period, we see a radical decrease in rough sleeping. That is the impact of that phased abolition of the priority need category in Scotland, combined with a slightly more benign housing market context. We then see in the second half of the 2010s some pressure related to those factors that were so important in England as well. And then we see the less dramatic impact of the COVID pandemic, less dramatic because there were less people on the streets in Scotland that needed help, but we still see that dip and we still see that uptick afterwards. So I wanted to sort of zoom out into just give a kind of summary of responses to rough sleeping and complex needs homelessness and what I see as the kind of key frontiers or areas of development here. The Housing First programme, which I'm sure many on the call will be aware, an evidence-based response to complex needs homelessness, that has been scaled up and efforts to mainstream it across the GB nations. But there continues to be a lack of Housing First compared to the scale at which it's needed, and concerns around fidelity to the model that are really about funding constraints in this environment. The second theme I wanted to pick up is around broadening responsibility beyond local authorities for who's responsible for rough sleeping and complex needs homelessness. And I think relevant here is a sort of a growing interest in the sort of inclusion health agenda and the role of health and social care in this, and also legal reforms, particularly in Scotland, that really try and formally broaden out responsibility for assisting this group. And we've seen a bit of that across the 3 GB nations. In Scotland specifically, and relating to Margot's presentation, we've also seen really interesting moves away from congregate hostel accommodation and shelters recognised to be part of the part of the dynamic of actually sustaining chronic homelessness because of the issues of congregating groups of people together over the long term and the impacts of that on people's health and well-being. And it might be worth noting that Scotland actually operated without any shared air dormitory style night shelters at all across the whole country from 2020 to early 2024, and now has one small scale one in one of its cities. So these are some of the key frontiers, but there remain real issues in terms of responding to rough sleeping. Gaps in the statutory safety net for single person households persist despite some broadening and the greater emphasis on prevention, and that's particularly the case in England and Wales. Immigration policy and law remains a really significant problem. We can't end rough sleeping in the UK under current immigration policy and law, and the adequacy of the welfare supports and the wider support system is really important, partly because of the very strained context local authorities are facing and their funding environment as well. So I just want to spend a little bit of time talking about temporary accommodation. This is a really key component of the legal rights-based approaches we see across the GB nations. Temporary accommodation is where people are housed while they're awaiting the discharge of that main legal duty for settled rehousing. So in a way, usage of TA is a good thing because people are being helped, but there are, of course, enormous concerns over it because of the scale of its use and because of people's experiences in temporary accommodation being negative. Even in the best quality temporary accommodation, people's lives are in limbo, often their social support networks affected, but also because lengths of stay in temporary accommodation are increasing and because there are real concerns about quality. While some people, particularly in Scotland, are in self-contained accommodation, many are in hostel or B&B accommodation that is sort of widely recognised not to be suitable. And some of those in England in particular are families, and there's real concern there. There's also acute concern about temporary accommodation because of the cost, and the cost of temporary accommodation is one factor that explains local authorities in England in particular really being on the brink of the local authority equivalent of bankruptcy and the challenges around that in England. And the drivers of these massive increases that are shown on the graph in England reflect some things that we've already discussed: weakening welfare safety net, a deteriorating housing and economic context. But also important, and you can see that on the right-hand side of the graph, is COVID, during which people kept coming into temporary accommodation, but stopped going out as the housing system stalled. And just very briefly to mention trends in temporary accommodation use in Scotland, the abolition of the priority need criterion by 2012 meant that use of TA reached what was at that point historic highs in the 2010s. And there was a huge focus initiated in the late 2010s to try and bring down temporary accommodation use, which I'll say a bit more about in a minute. But of course, the COVID pandemic meant the exact opposite happened. And as we saw in England, there was a rapid increase to new historic highs of temporary accommodation use in Scotland. Worth noting that quite a large share of that is in self-contained accommodation, though. And these TA trends in Scotland are one of the reasons that there is much discussion of systemic failure in the homelessness system and a national housing emergency in Scotland. So what have been the responses to this high temporary accommodation use? Well, in Scotland, we've seen the introduction of rapid rehousing transition plans, trying to really make homelessness as short an experience as possible using various levers. And RRTPs are now being developed in Wales to see if that can turn the dial there, because they've seen very dramatic increases in TA use in Wales as well. One of the criticisms that have been made, including in the last homelessness monitor focused on England, of the UK government is actually that its overwhelming focus on rough sleeping has meant that these kind of TA trends and wider homelessness pressures haven't been at the top of the agenda in terms of dealing with homelessness. One impact of the introduction of rapid rehousing transition plans is in Scotland has been to drive up the prioritisation given to homeless households in the allocation of social housing, which is widely seen to be a necessary way of dealing with some of these pressures, at least in the short term. But important to note that the level of allocations of social homes to homeless households is already highest in Scotland at about 50%, and it's about half that in England and Wales, so much lower in England and Wales, so scope there to give more prioritisation to homeless households, though there are inevitably, of course, trade-offs. Another important part of the response to high TA use and to pressures on homelessness more generally is the prevention agenda. And there's quite a long story to tell here, but most recently we've seen Wales and England introduce changes to the legal framework, trying to encourage local authorities to better prevent homelessness. And these have been really important and effective to at least some extent. But what has become really clear is that greater emphasis on prevention is very hard to effectively implement in the very challenging structural context I've described to you. And the gains of that preventative legal framework have actually been declining in England and Wales as a result of that. Scotland is in the process of trying to move to and introduce a more preventative approach that has been slower on the uptake. And I think there's a general acceptance that Scotland needs to up its game on prevention in general. So to start to bring us towards a close, I want to focus on Glenn Bramley's projections work, which forms a key part of the monitors. So what this graph shows is what trends in core homelessness Glenn models based on current policy scenarios. And obviously it's not a positive picture. It is a particularly negative picture in England, though. This is a GB-wide representation, so you can't see that there. But a key part of his analysis is projecting trends under distinct policy scenarios. And the core message of that work, as well as the monitors in general, is that these projected impacts shown in this graph are not inevitable. And that's what's shown in this final slide, in this final graph here. I'm near the end, Stephen. Glenn's scenarios and his projections show that there are 4 policies that are likely to have a very significant impact across all 3 nations. And it's just those I'll focus on. There are others that would also have an impact. The first is what Glenn calls rehousing quotas. Really what this translates as is increasing the allocation of social homes to homeless households, to core homeless households. And as you can see, that would have a major impact over the sort of medium term, over the next 8 to 10 years. A significant increase in the generosity of welfare benefits would also have a very significant impact across the GB nations. Similarly, raising local housing allowance levels and indexing them to rent increases would have a very significant impact. Margot and others, local housing allowance is the sort of housing component of the welfare system to help people pay their rent. And fourth and finally, you can see a bit further along on the graph, maximising homelessness prevention also promises to reduce core homelessness quite substantially, and reflecting the previous discussion, especially substantially in Scotland, where we really haven't made most use of preventative approaches so far. And that's where I'm going to end, hopefully about on time. Thanks, Stephen.
Thank you so much, Beth. Brilliant presentation and fantastically clear. Slightly worried about time, but if anyone's got a burning comment or question, I'm very happy to take it. Is anything anyone would like to come in with? If not, could I ask people, if you've got comments or questions for Beth, please put them in the chat box. I'm going to move on to Niamh. To talk to us about frameworks for ending homelessness across the UK, which I think is a presentation that, again, beautifully complements what we've just heard from Beth and before that from Margot. Niamh is implementation lead at the Centre for Homelessness Impact, leading partnerships and projects to support people working in and around homelessness to use evidence and data to enhance the impact of their work. Niamh joined the Centre for Homelessness Impact from the Simon community in Scotland, where she worked within their Housing First service and helped to establish the charity as a landlord providing homes for people who have experienced recurrent homelessness. So, Niamh, you're very, very welcome indeed. A plea to you to please stick within your time. So we've got some time for questions at the end, but over to you for now.
Thanks, Stephen. And can you see my screen all right there?
It's all there, looking good.
Perfect. Yeah, so as Stephen said, my name's Niamh Flannigan. I'm one of the implementation leads at the Centre for Homelessness Impact, and I will be speaking about our Ending Homelessness framework, which is one of our main programmes at the Centre, which we've been working on really since the start, but pretty intensely over the last 6 months. So really, really exciting to be able to share this with you. So yeah, I'm sure a lot of you will be familiar, I guess, with our mission, but in terms of who we are an independent charity and part of the UK What Works network. And our mission is to improve the lives of those experiencing homelessness by ensuring policy, practice, and funding decisions are underpinned by evidence and data. So in terms of the context of the framework, there have been multiple political commitments over the years to end homelessness and rough sleeping. But looking at that kind of broad statement, we always ask, what exactly does that mean? And if we don't have a clear definition of what that means, how can we measure progress against that? So what we're going to talk about is the work we've done at the centre over the last few years to focus in on that question and bring it to the policy conversation on homelessness in the UK. So homelessness is a complex issue and can be measured in a number of different ways. And we see that through our work, not just across the different nations, but also across different local authorities. And this ability to measure progress is fundamentally important because we love a saying at CHI, but as the old saying goes, what gets measured gets managed. So despite the complexity of interventions and responses, we often see what motivates politicians is get that bad number down, get the good number up. So which indicators you choose to measure that progress is really important. In homelessness as a sector, we've seen periods of significant progress, which has also been often followed by periods of the numbers going in the opposite direction. So it feels like a time where we really need to think more carefully about how we measure progress and how that influences decisions we make. So over the last couple of years, CHI have worked with national and local governments across the UK to introduce a shared definition of what ending homelessness means. And this is underpinned by a set of measures to cover all forms of homelessness to track whether what we're doing is or isn't working. And I should have said it at the start, this is bad form, but my colleague Heather McCluskey, who works predominantly in Scotland, and Rob Anderson, who's done a lot of great work in England, are both in the call and part of this great work. So the definition here, hopefully this will be familiar with a lot of you, and if so, that's a great thing. So ending homelessness means preventing it wherever possible, and when it cannot be prevented, making it a rare, brief, and non-recurrent experience. And as evidence shows, for an effective policy goal, we need to make it simple and memorable, make it based on the best evidence available to help drive forward efforts to end homelessness. So I'm going to do a quick overview of the framework here, particularly for those who aren't familiar with it. So there's 4 clear aims here. So starting with how successfully are we preventing homelessness? And it was really interesting to see your graph there at the end there, Beth, about how that was probably one of the most impactful things we could do. So prevention, then moving on to rare, how can we ensure that homelessness is rare across society? And noting that rare is a relative concept which actually can be measured. Moving on to brief, how can we ensure the duration of homelessness as brief as possible to reduce the harm people are experiencing? And finally, how can we ensure someone who's experiencing homelessness does not do so again and is supported out of the system for good? So this is a breakdown of the framework and something we've compiled and developed through the work across the 4 nations. At the top, we have that overarching vision split into the 4 goals there with core indicators. And they've been chosen as they're as useful and relevant as possible and cover all different forms of homelessness. You'll see rough sleeping there, you'll see temporary accommodation there, and overall numbers of homelessness. At the bottom, you'll also see additional indicators. So whilst this framework really proposes kind of the shared benefits across the UK, it's also worth noting the additional and specific challenges local areas face as well. So creating room for that when we're looking at data. So at the heart of this work is the idea the framework should simplify and harmonise data collection and reporting nationally, giving everyone a common language and a set of data, enabling us to learn by making it easier to understand what's happening and what's working across the UK. So the frameworks in each nation. So in Scotland, it's just a brief overview. We have the Ending Homelessness Together monitor. And this isn't to be confused with the monitor Beth was discussing. So the monitor covers 10 strategic outcomes and introduces 71 indicators. So it's rather extensive, but provides a lot of detail to the national picture, and especially on wider structural drivers of homelessness, such as health and housing availability. But something we would stress here is looking at the focus for local areas and what indicators are most relevant and useful for them. Similarly, in Wales, we have the Ending Homelessness Outcomes Framework, and this was developed also with CHI's support. The framework is extensive, and in addition to rare, brief, and unrepeated, it has 3 additional outcome areas. It was published early this year, however, it's not been implemented yet. In Northern Ireland, the Housing Executive published their 2022 to 2027 strategy, Ending Homelessness Together. And on the right of the screen, you will see what was included, their overarching aim, which includes prevented, rare, brief, and non-recurring, which was great to see and a real step forward. Last year, they built on this progress and committed to developing a data-led framework to ending homelessness. As housing and homelessness policy is centralised in Northern Ireland, this will give initial consideration to housing executive data. So working with local areas across the UK. It's great that each nation has adopted the framework at some level, and we think that's a really positive step forward. However, as we have particularly witnessed with the development and implementation of the rough sleeping framework in England, there's a real opportunity to draw on that local knowledge and ensure that national frameworks are framed around kind of local insight and ensuring that data collection is all there. So looking at Scotland, one of our main partners for a number of years has been Aberdeen City Council. Back in 2022, CHI worked with them and helped them develop a framework of indicators. And now with the monitor published, we are looking and working with Aberdeen to adopt a prototype for a local approach to using the national monitor. So this will include prioritising indicators that they see as most relevant and ensuring that indicators are brought into their routine settings. So the leadership team are using these on a regular basis to inform decisions. Alongside this work, we are hoping to work with other local authorities with the eventual aim of providing recommendations to the Scottish Government. In terms of Wales, we are also working with local authorities, and there's been a lot of headway made there over the last 6 months. We've successfully recruited 6 trailblazer local authorities to collaborate with us, which is fantastic. So a lot of that work is about aligning local strategies, prioritising indicators, and embedding the framework data in practice, obviously with the eventual aim of giving recommendations to the Welsh Government. In Northern Ireland, last year, along with the Housing Executive, we established a working group of representatives from across the sector, so including the Department for Communities, third sector organisations, to help co-design and implement the framework. So at this point, we have recommended a core set of indicators. We're looking to move on to the next phase, which will be refining measures and testing them with the eventual aim of bringing those indicators and framework online. And lastly, England. Next month, we'll announce the rollout of the Ending Rough Sleeping data framework as complete. And building on this progress, we are two-pronged approach, embedding the framework into use, so ensuring local authorities are really drawing on that new data collection and making the best use out of it, and then also expanding this work into all forms of homelessness. So the two key areas we see are our evidence coaching partnerships and our ongoing systems-wide evaluation. So looking forwards. So adopting a shared framework, as I've said, is a really important step forward in the quality, frequency, and use of data on homelessness across the UK. However, data it's only part of the answer. And as Beth went over very well, homelessness is on the rise again in all its forms. And so really part of this work, a key part, is to take advantage of the framework and turn insights into action. This is an example just looking how a framework might be used locally. So, I mean, the foundational argument is that we use those indicators to build a cycle of progress. So using those insights to drive delivery. The diagram I have here outlined, so our example is Alex presents as homeless. He tells his team he has recently left care. The data is reported under indicator P2, so number of people leaving places of care of homelessness. In reviewing this data on a monthly basis, the local authority sees a pattern, the increasing number of people experiencing homelessness who are care leavers. And then they learn from a neighbouring local authority who's reduced this user group, but their overall numbers haven't reduced. And this is because they've put in extra support through working with social work and put in funding for new positions. Acting on this data, they build a case to invest in a new role to collaborate with social care services and part fund a local service. And the result of this is within a year, the number of people leaving place of care into homelessness has reduced. Now, a lot of this we see informally through our work, but the framework is here to provide a kind of structured and formal approach and to encourage that shared learning, particularly across local authorities. I've just included a quick example here. This is the rough sleeping framework in England that I spoke about, and one of the early adopter groups was Greater Manchester. And they're a real example of using those insights from the data to drive delivery. So from their new data they received from the framework, they've gained an understanding of how rough sleeping patterns were changing over time. They've explored variations between different parts of Greater Manchester and the different challenges the areas were facing, and they've spotted emerging trends. So they've seen a sharp increase in the number of people new to rough sleeping, leading to a rapid change in service response. Interestingly as well, the framework data has allowed them to increase the nuance of the picture they present to the media and the public, and explaining the reasons for that increase in rough sleeping. And kind of finally, nationally, what are the key aims that we're looking for? So the framework aims to provide a better foundation for these three most important factors. So firstly, it aims to inform the development of policies and strategies. So providing that kind of common data set, supporting discussions across governments, across different departments, across sectors. I know, Beth, you spoke about that in terms of health and justice, and that's really important, that we're all singing from the same hymn sheet. And the second point is identifying areas that are succeeding and understanding why. So having that comparable data and understanding what's working well and how can we share that learning. And then the third is testing policies and interventions in real time. And this is a piece of work that's really at the heart of CHI's mission, using that comparable detail to provide the basis for impact evaluations and trials to grow that much needed evidence base in the sector. So finally, to wrap up, the idea is that the framework provides a better foundation for learning and improvement, so that when things aren't working, we have a better idea of why and can make better policy decisions and practice decisions. And we can also take deeper insights into what is working well and scale and mainstream it. Thank you.
Fantastic. Sorry, another wonderful presentation. Thank you so much, Niamh. It was so beautifully clear, and it's great to see those explanations of how the data framework will be used locally. Again, tremendously clear, and shows what a useful tool this framework is. We've got a bit of time. Thank you for sticking to time, Niamh. That's most appreciated. We've got about 5-10 minutes for comments or questions. I denied people a chance to come back on Beth's presentation. If anyone would like to raise any questions on that, please do. Equally, very happy to take any comments on what people have just heard from Niamh. Who would like to come in? Or if you want to pick up on any of the three presentations, I'm most happy to receive comments. Who would like to come in? We overwhelmed people with analysis and facts. If not, maybe I could just pick up one thing. I don't know whether this may be for Beth, but it could be more general. One thing, Beth, you didn't do was in relation to England. I mean, the rates of homelessness, rough sleeping, vary enormously across England, and the England figures are very much dominated by London. To what extent do you think we ought to be taking that into account in how we present, say, the figures for England, indeed GB as a whole?
Yeah, it's a great question, Stephen, and one of the many very important things I didn't cover.
Sorry.
Yeah. I mean, I think we need to take it into account a lot. I think that's been taken on board in terms of discussions of and representation of sort of rough sleeping figures, and you can see that in the graph I shared. But I think the challenges are completely different in London and some parts of the south as they are in the north of England. So that absolutely has to be, central to the discussion. My only explanation is that I was focusing on the GB-wide comparisons, which flattens that a little bit, which is not that helpful, but, didn't want to take another 10 minutes. But yeah, I mean, it's really essential to think about London differently because of the scale of rough sleeping, the scale of homelessness, the scale of temporary accommodation, what those things look like, reliance on out of area placements and a different profile of temporary accommodation in use, but also because of the immigration side of things, which looks very, very different there than in other parts of the country. So yeah, just couldn't agree more, really.
Okay, right. Someone's got their hand up. Is that you, Matt? You've got your hand up.
It is indeed. Yep. Hi.
Sorry, I couldn't see who it was. If you've got a question, if so, fire away, please do.
Yeah, just a quick question for Margot. I was struck by the fact that many people who are threatened with eviction left before the kind of statutorily required 30, 60, 90-day window. I'm wondering what kind of interventions do you think would be most effective to prevent that? And I also had just a couple of maybe really simple questions, but I know that the Eviction Lab has found that the higher the cost of filing an eviction for the landlord, the lower the rate of eviction. And the kind of simple fixes like that. I'm wondering what kind of protections does California have in regards to eviction, and then what kind of improvements are needed?
Yeah, great questions. So I think where California stands out compared to other states, believe it or not, we have better eviction protections than other states in the sense that there actually is some statewide eviction protections. There's a huge, the United States has some things are federally determined, some things at the state level, some things at the county level, some things at the city level. And eviction actually can have things, there's almost nothing at the federal level, state, county, local, ordinances and statutes and things. And so the fact that it's harder, that there is something on the books for 30, 60, 90 days is better than actually most places in the US. I think there are a couple of problems with that. One is that we don't have a statewide what's called just cause eviction, which means that a just cause eviction in the US means that it narrows the window of things for which you can be evicted for, and we don't have that. So that's like a pretty basic thing that people are fighting for. But the other thing is more operational. There's no, in the US, you have a right to counsel for criminal, but there's no civil right to counsel. And so landlords have lawyers, they know how to use a legal system, and tenants don't. So you see some jurisdictions, local jurisdictions, starting to experiment with a right to legal counsel in eviction court. You obviously need to tell people that they have that right so they can exercise it, but that has been shown to make an enormous difference, just to have a lawyer tell you what your rights are. My husband's an attorney, and sometimes I would read him transcripts and he'd say, like, they can't be evicted for that. They can't be evicted for that. Like, any lawyer, any paralegal could have stood up there in court and said that, but people don't know they have the rights, they don't exercise them. So that's one thing. Making it harder, making it stickier is one thing Eviction Lab says for landlords to file. So just making them have to go through more to file, just sort of increasing the hassle factor can slow things down. And then the final thing is on the other side is the penalties for having an eviction. You might have noticed like well over a third said it was prior evictions or credit history that kept them. Having an eviction on your record makes it nearly impossible to compete for an apartment in these tight rental markets, because that is absolutely illegal for landlords to use as a factor not to choose you for housing. And so I think that is the other side of it, is to lower the cost of having an eviction. Might also increase people's willingness to contest it, because what we heard from people is like, I knew I was going to lose. And then it's recorded. And if it's not recorded, it's not on your record. Like if you leave before it's been filed, then they don't know. So those are just some ideas.
Brilliant. Look, I've got a couple of hands up from our presenters. Beth, you're handed up. Did you want to come in again?
Only if it's okay.
Yes, of course.
Yeah, okay. Margot, gosh, I could ask so many questions, but I'll ask one. You mentioned that there's increasing public outrage in California. I mean, rightly and understandably so. I guess my question is, to what extent is that, or just the harm associated with homelessness, receiving any traction at the city level, at the state level, at the federal level? Like, to what extent among those decision makers is there acceptance of, I guess, the core argument I was making, which is that this is a policy and political choice, and it really doesn't have to look like this? Is there any prospect of an improvement? You mentioned the legal case, which maybe makes me think not, but
we are in a really difficult political movement. It's really interesting. We obviously have like Republicans and Democrats. There's almost no really third party in general in the US. And in even the George W. Bush administration, which was, we were joking yesterday, like we're now looking back very fondly on that administration compared to what has been and what is coming. But obviously it was really a very conservative far right. During that administration, they were the ones to bring about housing first as a policy. They actually were the ones to start to turn the tide, because they just like looked at the ledgers of like, oh, this is really expensive. What has happened now is that there is a complete political divide. And in the same way that trans rights have become a big split issue, this has become an issue to weaponize, because homelessness is much more visible and much worse in blue areas, because it tends to be worse where housing costs are high, where there's big income inequality. So that tends to be the blue states, and also like the blue cities that have had lots of educated people move to them who have done a terrible job building housing. Like, it's not like they are right, but they've done a terrible job building housing. But like the de-invested areas are mostly Republican. So the places like rural areas, disinvested cities are mostly Republican, and these blue areas have actually a much worse problem. And so now it has actually been weaponized, totally separate from any like reality on the ground of what's going to improve it. It's just become political football. And it's it feels very hopeless right now, because the conversation is almost totally disconnected. And what you see is a lot of the sort of Democratic mayors, Democratic governors are starting to be fear for their political careers and are buying into that weaponization. So you see someone like our Governor Newsom, who I'm quite a fan of, but definitely has federal, has ambitions to be president. He ran on a bunch of things that would have actually helped a lot, and he's done a lot to help, but he's getting so pushed that he's now supported the Supreme Court, on the wrong side, basically supported the criminalization and things. So I think right now we're in a very tenuous political environment, and a lot of us are feeling quite hopeless unless we can somehow turn the conversation. Because what I like to say when I go to, let's say, business groups is like, this is in your interest to solve also. Like, this is like terrible. This is costing us a lot of money. It's, it's limiting conventions and travel, and like businesses don't want to be around, and people don't want to, like, this isn't helping anyone. But we're sort of fighting against a very organized campaign to weaponize this issue in a very punitive, non-productive way, and to really focus on the individual factors as opposed to the structural factors. So I guess I'm not that optimistic right now.
Thank you so much, Margot. I'm going to take one more comment, and I must bring things to a close because we're almost at the end of our time. Niamh, your hand is up. Please do ask your question or make your comment, please.
Thanks, Stephen. No, I'm just responding to a comment in the chat there. I think it's from
Please
Stephen.
do.
I think you're just wondering whether how the aim ending homelessness relates to the framework's application. So seeing it as about reducing homelessness rather than stopping it altogether, I think that was the question. And I think that the main point of the framework is providing that nuance. And as evidence shows, ending homelessness completely, bringing it down to zero, is impossible. And so it's giving that alternative. How can we reduce it dramatically, and with that focus on prevention, and guide the conversation that way? So hopefully that makes a bit of sense. That's what we mean by kind of ending homelessness, is focusing on those kind of key areas.
Fantastic. All right. Look, we're 1 minute off the end of our time, so I need to bring things to a conclusion. The past hour and a half seems to have whizzed by, but I hope everyone has found this meeting useful. I think we've had 3 absolutely brilliant presentations, tremendously clear. So we're in great debt to Margot, Beth, and Niamh, our guest speakers. So thank you for being with us. Very much hope we can get you back. I mean, given these presentations, we must find another opportunity for you to come and talk to us. Huge thanks too to Matt Gannon at the Centre for Homelessness Impact for organising the meeting. Great to have such a good turnout too. We'll let you have details of our next meeting and what it will cover as soon as we can. We'll send around the slide presentations from today's session. But if there's something you would particularly like to see us cover at future meetings, or indeed something you'd like to present, then do let me or Matt know. Or if you've got thoughts on ways in which we could make these sessions even more useful, then again, please do let us know. We want to make sure that they deliver as much value as possible. But for now, huge thanks everyone, and we must definitely be together soon. Lovely to see everyone. Take care.
Thank you so much.
Thank you. Bye-bye.